Hi, everyone. So this is a pretty big, broad, deep subject, lots of vertical areas. I'm going to cover a slice of it, kind of do it in two parts. It probably deserves 20 parts, but no one would come for that probably. But anyway, we'll cover a piece of it tonight. Devin, can you hear me? Okay. So go to the next slide, please. So here's the agenda for part one. We'll do an intro, some discussion about the authority for cybersecurity, who's telling us that we have these requirements more than just a business reason that we would do it. Some background, and then sort of my take on the solution for cybersecurity. And I'm also going to give you some idea what the scope is. We'll be down in the device level at this part one, and then a summary, and then a little bit of a preview of part two that'll be in September. And then we'll do questions. If you have questions along the way, you can definitely ask. If it's something that I'm going to hit later, I'll probably defer it and we'll go on. So there's a lot to get to, so I'm going to go quickly. If you don't mind, go to the next one. So this is the kind of stuff everybody thinks of when you think of cybersecurity. Something got hacked, right? And hopefully it's not your toaster. That's now a blender, but anyway, go to the next one. So cybersecurity issues are increasing due to the number of wireless endpoints, networked and interconnected devices. There's also this trend of wellness products like Fitbit and things like that, and they've actually stated that they're going to shade into medical device intended uses. So there's going to be this blurring of the lines, so that'll even put more devices into the arena. And as we know, a lot of us here, I think, work in development or supporting development from a quality function or whatever. The velocity of technology changes has really increased, and it far outpaces the ability of regulations and those types of things to keep up. So it's my belief that these factors have combined to kind of push the government into a point where they want to do a cooperative industry-government cooperation for this, because it's really going to take all of us to make sure we have the right frameworks in place to protect the endpoints, and it's really not going to come from regulation. It's going to come from an industry-led thing. So I'm going to talk a little bit about the legislative and regulatory authority from a national, state, and local standpoint, and then also about statutes, and then international regulations and policy expectations, and that's more for part two, but I'm going to hit on it just so that you have context for what we're talking about. Go to the next slide, please. This is the some of the current departments in the U.S. government and then the state of Texas. The ones that I'm really going to talk about today are the ones I've circled in red, which is HHS under HIPAA, and then FDA is also under this, and then Department of Commerce thinks they have something to do with medical devices too, about how they're marketed across lines and all that. So, and they kind of hang their hat on the NIST that we'll talk about as well. There are others, but these are the main ones. So the HIPAA is 45 CFR 160, 162, and 164, and that came into in 1996. There was a privacy rule for your own personal health information that came into play in 2000, and then kind of the real teeth of this was the 2009 breach regulations, and there's a lot of rules around that about if it's a single breach, you have to notify the person. If it's 500 that got exposed, you've got to do media blasts and things like that. So it's a bigger deal, and so you don't want to be in that category. Next. HHS also has the FDA, and they have published their cybersecurity guidance for pre-market, which means everything you do before the device goes to market. and that was in 2014. Now they've recognized UL 2900 series of standards for really device protection at the endpoint level. And then they have released their post-market cybersecurity guidance in 2016, and that's for devices that are on the market now. So how to protect those. They've just in the last 2 days released this medical device safety action plan, which is new, and I'll talk about that as part 2. But I did put a link here, so in case anybody wants to jump in and read it early, you can. But we'll talk about it later. Next. And then remember I mentioned in the Department of Commerce the NIST framework. That just came out in the last 2 weeks. Well, 1.1 did. The 1.10 came out in 2014, and it was due to an executive order to improve our cybersecurity infrastructure. And the thing that goes with it, and I don't know if people think of these together, but kind of I do, the ISO 27000-1 information security management and NIST 1.1 will mesh together very well at the network level, and we'll kind of talk about that next time. This is the state of Texas, and they have the DIR, and they push it down to most of the agencies, including universities and places like that, where they require them to put a security action plan in place, and it really mirrors the NIST framework of the 5 functions and the 40 objectives that NIST puts out. It is a little curious. State of Texas does it. Other states do more. Most states do less. But we'll kind of talk about that next time.
I missed what the acronym of NIST was.
It's National Institute of Science and Technology. Yeah, I didn't really define it. So. And then from an international standpoint, there's the UK just put out their Secure by Design. So they have they've had a lot of academic works and kind of public-private cooperations where they did a study with some white papers and things like that, but they finally took all that and wrapped it all into one thing, and it's this Secure by Design. So we'll talk about that next time as well. The GDPR, the reason I brought this one up is it's brand new. It's new in the last year, but its effectivity is May 25th this year. And the thing about it is if there's a data breach that this data you're supposed to be in control of and protecting, and it gets breached, there's up to a 20 million euro fine for that, or 4% of your revenue, whichever is greater. So this one has a lot of teeth. That one's a very scary one. And then we all know about MDR, IVDR, and so we'll talk more about that next time with part 2. So for the background, just if you think about medical devices in general, connection to a network is relatively new. It's in the last 20 years, right? And connection to the internet's really new, like in the last 5 to 10 years maybe. And medical devices are considered easy to hack, or they have been historically, right? There's lots of university professors that have projects that try to go and do that. And then, so if you combine all that, cybersecurity is a relatively new concept, right, for medical device designers like us. And there's an exponential increase in the number of connected devices and components. So those things together really play into, do we need more protection and a better framework for security? Next. So we're not going to get away from connected devices because the benefits are so great, and I mean, there's unimaginable benefits that we haven't even thought of yet. So it's going to continue to increase, but that creates an increasing risk for patient safety, patient data, which we're supposed to protect, business profitability, and brand reputation. And you can imagine all those scenarios. Next. Excuse me. So there's been reports of hackers harming medical device users by stealing their data, holding their data for ransom, holding the device and the user for ransom, or using the device as an entry point into a larger connected network. That's the main one. And that's what kind of, one of these things is what Dick Cheney was concerned with when he had his defibrillator wireless component disabled while he was in office, because he figured that was an entry point. And they actually, if you go back one, in the entertainment world, they took advantage of that and actually killed off the vice president. So anyway, so my thought is we really have to do a better job of defensive design. And so traditional design is centered around the intended use and making it work correctly for what we know it's going to be used for, and with some thought to unintentional misuse and things like that. Since our operating environment, though, is not safe, that yields some vulnerabilities. So our new approach of defensive design must comprehend that the rest of the network that it's connected to is hostile, right? So we have to look at it that way when we analyze what are the vulnerabilities and the threats. Go next. Excuse me. So in part one, I'm really only going to talk about the first three of these: data, application, and host, and then part two will be the rest. So this is the concentric circle of from the device out to the world. Next. So our threat landscape is very complex now, and we have to approach it from really from a design standpoint, from prevention. Really, we want prevention. If we have to, we'll do mitigation. But so that's what these that's FDA's thought as well, and so that's their thought on the pre-market, post-market, and UL 2900. And this new medical device action plan is just a strengthening of that. Next. So for the pre-market guidance, the main tenets are identifying the assets, the threats, and vulnerabilities, assessing the impact of the threats and vulnerabilities on the functionality and end users and patients, assess the likelihood of a threat being exploited, so does the threat become real, determining the risk levels associated with that and suitable mitigation, and then assessing the residual risk and risk acceptance criteria. And it's really part of your 14971 risk management program. It needs to be cybersecurity as well. So it's the same approach, just analyzing those risks as well. Go back just one second. The 80,001 is risk management for IT networks, so that have medical devices on them. So 14971, and they're very similar, but it's for a different purpose, for IT purpose. Next. Excuse me. So under identify and protect, if we can effectively limit access to trusted users only using these strategies with strong passwords and timeouts and role-based access, which means leveled access to functions, and authentication before updates, so that's when you get a software update or a patch or whatever, you really have to make sure it's the right update. And then making sure your content is trusted and authenticated. So you restrict updates, and you have systematic procedures for downloads and secure data transfer between memory entities, any kind of a connection, those types of things to keep the man-in-the-middle things from affecting your device. Next. Detect, respond, and recover. These are features to enable detection and logging of compromises, because there's a requirement to, you have to actually report it now. So you need that information. So you've got to log it somehow. Excuse me. You want to be able to give info to users on actions that they need to take to help with cybersecurity, either isolating the device or whatever they can do. Protect critical functionality even if a breach occurs. And retention and recovery of the configuration if it's compromised. Next.
Hey, Garyld.
Sure.
The break the glass concept, what does that mean?
That's if it may be you can't go back, but you can at least load the last known good configuration into memory, right?
Okay.
So that you're able to then access the device later and get the logs off or whatever. So documentation. So this is documentation that we have to create to submit with your pre-market. Hazard analysis, of course, with mitigation and design considerations, and they want a specific list of cybersecurity risks and a specific list of justification for all your controls. There's trace matrix, which would come out of this naturally just because of if you had a good risk management program already. A summary of a plan for validated updates. Controls to ensure software integrity through your distribution channel. So that's another important way that things can get, you can have a vulnerability. And then IFU and specs related to cybersecurity controls for the environment. So if you know it's going to be on an internet-facing IP or something, you have antivirus and firewalls and those types of things. Thank you. So going on to UL 2900-1, it's a top-level standard, and there's some lower-level standards that are going to go with it. The bottom two down here are not released yet, as far as I can tell, but they're in plans, and they're more of a process-related standard anyway. The top-level standard, it has expectations for UL testing, and so UL was proactive and they wrote the standard, and they're going to get business from this because they're going to actually have to accredit you. So you can do all the cybersecurity risk management, and they'll have to assess it and assess a fee for that assessment. That makes sense. And then these are the industry-specific collateral standards. The top one is more the one we're interested in, and this one here, the -2-3, is the newest one for IoT endpoints. So we'll talk more about the -1 next. So for that standard, you have to list all the functions that are provided, including the management of those. External interfaces, physical interfaces and outputs, remote, local interfaces, connections between processors, any way that someone could get access to what's going on inside the device. Communication protocols, list of all the executables and libraries, including third-party and open source, which are, we call them SOUP, and so you need to do a cybersecurity risk management on the SOUP as well. Source code that's actually in the product, including interpreted code and compiled code, configuration parameters, those types of things, binary code or byte code, and you have to list the product software build and integration process. So a good build spec or version description document is probably going to be needed as well. A security risk analysis, which is what they call it, and design documentation to allow them to actually look under the hood to see how your controls actually work. They want to see how your controls work. Next. So they also want to know how the product's used in the use environment by the user groups. So these are the types of things they're looking for, which is your normal usability human factors usability type things. And really related to the security considerations and anything that the user is going to have to contribute to make sure that the device is safe. So if the user has to contribute to the safety of the device in some way, they want to know that and kind of how that could go wrong, right? Instruction for use and documenting all the functions, external interfaces and comm protocols, all versions of software, so kind of a version description document or that you would talk about in your configuration management plan. We try to log everything that is related to how the device is used from here's what got commanded, here's what we set it to, those types of things. So you know, and then you know what happened, you can actually go back and recreate what happened. And then a document about the product's authentication method. So how does it authenticate users? How does it authenticate use, connections, things like that. Next. These are the foundational elements, and these all have their own standard. So these are the integrity and authenticity of data for different types of data. So you can look in these for guidance on how to implement these. These are your mitigations for lots of things. And then you have to validate these functions because they are going to be used in a situation where they're a mitigation for something bad that could happen, so they've got to be validated.
So my
Next.
question is, if you're trying to relate this back to medical devices, so then would these be translated into product requirement specs?
Well, it depends. So if you had say you had a cybersecurity vulnerability and then you trace it all the way down to, I have to have some way to protect the integrity of memory, right? That program memory space, right? Well, maybe a mitigation for that is I encrypt it all, right? And so one of these, cryptographic techniques in 15946 would be what you would use for that. And then it becomes a requirement then because it's a real risk management mitigation control that you have to test, and you have to prove that it's safe and effective at the time it's needed. So you try to access that memory and you're not allowed to, you don't have the key to the encryption and you can't, right? Or whatever. I'm making that up, but. So risk controls around access. If it's a secured function, then you need to authenticate. Always have a timeout. Don't leave ports open and all that to allow access. And timeouts should be really short, right? And if it's computer time, really short. But if it's human time, a few seconds. Access via remote interfaces, you really got to authenticate those. You got to make sure people that are interacting with your device are really allowed to. And then services over wireless get special attention and should have special user authentication. And then, all the things that are wrong to do, but everybody does them, like on your wireless access point at home, they all have, if we had the same brand, we'd have the same password, right? And the same, anyway. All that stuff you're not supposed to do. That's what this one's about. And then really enforce role-based access. So only a very few people should be allowed to do certain really dangerous things, right? And only in certain modes. So you would have a mode and context-based access that really should only be allowed for certain things at certain times, especially when it's not connected to a patient. So you would not allow most of these things in a patient situation. And then your risk controls need to be explicitly articulated as requirements in software specs. And we kind of talked about that a second ago, where if it's really a control, it needs to be written in the form of a requirement. So it gets tested with your normal test program through verification, and then you have actual objective evidence that it does work and is safe and effective when it's supposed to be. Next, please. So managing user accounts, I think everybody knows what that means. Enforce the principle of least privilege for every authenticated account. If you lose the session or timeout, it's like you start over. And if you're not using username password for authentication, then the bypass is invoked. Next. And then really ensure the integrity and authenticity. I put this on a page all by itself. Really ensure the integrity and authenticity of all data. And that points back to that foundational list of controls for that reason, because there's lots of different pieces of memory in your device, probably, and all of them need to remain under protection at all times. So, next. A little bit about cryptography. Ensure the confidentiality of sensitive data, which is patient data, anything patient-related, anything person identifiable. That's where the biggest fines are, especially in GDPR, which we just mentioned. ID and document, which data is considered sensitive. So we're going to say we're going to have maybe a patient name in there, and we have to really point that out and say this is how we're going to protect it. Utilize only the approved list of cryptographic algorithms, and then you can't use the same key for the same algorithm in different places. So anyway, all the good design things that you should do. Next. From a product management standpoint, if you're planning for your device to do field updates, make sure that you can roll it back, because if it isn't successful, you want to be able to get back to a known good configuration. And the memory that you use for the update and the memory you use for the previous version need to be protected as well, and the application protected. Verify authenticity and integrity of the update. This is the login again of the security-related events. So it should be a log entry, and the update should not erase the logs or whatever. It could compress them, but not erase them. They need to remain available on the device. And then when you're storing the logs, they have to have the same protection as every other important critical parameter in your device. And that means that you only allow certain users to access them in truly exceptional moments, like your MDR complaints folks would maybe be the only ones that can actually get into memory to see what happened to a device in case there's a product complaint. And then when the device is manufactured, that first time it powers up, it will have some default things loaded, and so you want to make sure those all get reset to secure settings. And then when you decommission devices, you have to make sure that all that data is properly removed from the device before decommissioning.
I have a question on that first.
Certainly.
The previous slide, first sentence, it says, enables the possibility of update and rollback if update fails.
Yeah. So, say you have I'll make this up, you have an infusion pump, and there's a new version because there's a couple of bugs that somebody wants to fix, right? And they say, okay, here's your new software. And they go to load the new software, and the reprogram doesn't work. So the device is bricked. We call it bricked, but the device is not usable, right, for some reason. because the update didn't work. You want a way to go say, okay, load the previous good program, and it loads it and it works. That's what that means.
Like, let's say if, so we uploaded the new software and it's like 1.2.
Yeah, 1.2.
Go back to 1.1.
Yeah, 1.2, but if 1.2 works, then you don't. But if 1.2 doesn't work, then you want to be able to go back to 1.1.
And is that commonly done though? Like, have you, is that your experience with
If it's a good design, it's done. If it's not, it isn't. And there's a lot more of the not, I'll say. Yeah. Yeah. Thank you, Mai. Okay. Any other questions here? So this is all good design stuff, but everybody forgets about it, so I'm kind of reminding you. But this is from a product management standpoint. So your product manager should be putting in marketing requirements that point you to requirements that make you do this stuff, right? They say, I want to be able to upgrade in the field, but if the upgrade doesn't work, I want to be able to go back to the previous version. They would say it like that, but in the engineering group, we're going to say it differently. We're going to have a dozen requirements around that talk about how that works. Does that make sense? Next, please. And this is product management continued. So this is more about updates, message authentication codes for software and firmware components, digital signature generated on them. So you have an authentication code, you know what that memory is supposed to contain, and you can independently calculate that authentication code and match it with the one that's stored with it, right? And a hash function is another way to do it. And then it's a good idea, and you're in a good place if you can point all your integrity mechanisms back to one of the foundational, that's on the foundational list. Next. Okay, so for risk management, so this is just like your other risk management program, but it's addressing cybersecurity type risks. So you have to ID your functions, store data, how it's processed and used, your list of threats, and its functionalities and data, impact assessment per threat, so that's your severity, right, in your hazard analysis, and your likelihood of occurrence. And then what is your predefined risk acceptability limit for that? Because that tells you how much mitigation you have to do, or prevention hopefully, but mitigation if you have to get to that point where you don't have to mitigate any further. And then assessment of that residual risk and how likely it is and how severe it is because at some point the whole question of economics versus design has to come into play, where I could spend 10 more times on R&D than I did, but I only get a very small increase or improvement in residual risk. The folks that run the business are probably going to stop you. So if you can somehow quantify what the residual risk is, then you give them a good decision point. And then a use classification scheme for the risks identified. And this is talked about in the standard. There's a common attack pattern. There's a CAPEC. And then there's a DREAD model. That's damage, reproducibility, explodability, affected users, and discoverability. So that kind of gives you a way to quantify things. Next. And then you want to document the risk evaluation method for your known vulnerabilities, your criteria. You want to establish your risk acceptability limit for that, and then factors considered use the factors in the CVSS score. And that's a linked document from 2900 that you would go to, and it tells you how to do that. And then if you're allowing the the presence of any known vulnerabilities, you have to describe its common vulnerability and an exposure identifier, and you kind of have to explain why you're allowing that to occur, and the software location of the vulnerability, and a risk analysis showing it's acceptable. This is a little bit, I think, of an exceptional thing, but it's an out. It's a little bit of a squishy area. I don't know how many people use this. We try not to use that in any of our designs. Next. And then document risk evaluation for known weaknesses. Can you go back? And same thing as we did for the known vulnerabilities. Establish the limit and score it, and so that everybody on the design team and management has a good idea, has a good picture of what the risk is that they're accepting, and can defend it when the time comes when the medical benefit versus the risk question comes into play, because there's going to be that discussion at some point. And then the common weakness enumeration, so there's a standard for that as well, and it gives you information on how to describe that. There's a link here for that. Next. So the compliance lab is going to review your documentation and assess it for sufficient coverage with regard to functionality, data, and threats, and impact. And then did you really adopt your risk controls, and did you justify why you didn't reduce the risk? Like if you left one in and you didn't reduce that one, what does that mean to the design in the bigger context? And they're going to want some pretty good justification, I imagine. And then did you sufficiently implement the risk controls, and did you test them? I didn't put that on here, but that's really what they care about. And then evaluation of the assessment of known vulnerabilities and weaknesses is actually present, and they assess that through the trace matrix. Next, please. Yes. You are, but you have to go through compliance first, right? So you have to go to the compliance testing, so 60601-1, or whatever your particular standard is for whatever device it is. The common general safety standard is 60601-1. And it requires 14971 for risk management. It requires 62366 for usability, and 62304 for software. If your device has software, it's software controlled. You got to have, those are the basics. And then next, please. So these are vulnerabilities and exploits under design and test. So here's a consideration, and here's the verification, or the compliance verification. So if you had a third-party library, you would check the database and make sure it's clear. You check the bytecode and make sure there's no malware included. Same thing with interfaces. Next. So you would do white box testing here to try to really challenge your implementation and make sure these things are in place. And then that, hopefully that doesn't reveal anything, then you've done a really good job in design and you're ready to go. You can also do port scans and sniffers for traffic, and you want to summarize your plan for how you're going to roll out validated update patches and major updates. Next. So one of the considerations is you have no weaknesses, like we talked about, except those that are determined to be acceptable. And a couple of the ways you can do that is through static code analysis, and that's tools like lint or ProMet or Misra, if it's C. And here's some links to information about that. Next. This is the telecommunication union X series of documents, just as a reference in case you're interested. And that's the CWE that we talked about, the CVSS we talked about, and CWSS and the CAPEC. Next. So that's kind of the end of 2900. The post-market guidance for FDA, and this is for devices that are already in the field. So they're fielded now, but they weren't subject to cybersecurity pre-release or UL 2900. So these are devices that are out there right now. Monitor cybersecurity information for new vulnerabilities and risks. Maintain a robust software lifecycle process. That includes monitoring your third-party software and all the libraries you have included in your device. Do a really good V&V, have a good V&V program for your updates and patches that roll out. Keep updating your risk management file and keep it up to date with the latest. Disclosure policy, so you gotta let everybody know what the issues are. And then make sure it maintains essential performance throughout the life cycle. And then this will assume that, so for things going forward, you're gonna have a pre-market process that you're gonna subject it to. So even though it's out in the field, it gets a new software, it was put through the ringer in the pre-market process. Update the cybersecurity for PMA devices in the PMA periodic report that you have to file. Participate in the information sharing analysis organization. And because the only way we're gonna get better is if we all you share the information you know, and I share the information I know, and we all can protect against the vulnerabilities that we all know about collectively, right? And it has policies for, you have to have policies in place for sharing your information, and you can de-identify it, so you're sharing just information about the vulnerability. And then make sure you keep it up to date, and actively participate and make sure that whatever their vulnerabilities somebody else is reporting, that you assess them against your design. And the post-market guidance can be downloaded at this link. Next. So this is the summary. Cybersecurity threats are increasing. You need a robust 14971 risk management process that includes cybersecurity threats and vulnerabilities. You need to practice defensive high reliability design, which I just put a couple of examples: encryption with compass, data integrity checks, highly partitioned architecture, those types of things. Ensure the integrity and authenticity of remote connections to your device. Robustly monitor breaches and make sure that your product complaints and MDR program report them properly, and that you are participating in the ISAO organization so that you share that vulnerability in case it happens to you. And you're going to have a cybersecurity section in your software submission for a 510K or a PMA. And then kind of the bottom line is a good cybersecurity program makes good business sense, because you protect market share and you protect your users, and you continue to make a profit and have a job, right? So that's a good thing. Next. This is a preview of part 2. So part 2 kind of steps away or further out from where we were talking about inside the device, and we go to the network, parameter, physical, and policies. And so it'll be a little bit more of things in the IT world. When we, for part one, we had to consider this was all compromised and we had to operate properly. So if we have that nailed and then we look at this and say, can we make sure it's on a really safe network, then that helps us as well. So then you'll have a truly robust program. So we'll talk about NIST 1.1. It's voluntary, but not really. So it's voluntary unless you want to do business with the government, or you know what I mean. So it's one of those, help us, we'll help you, but we're expecting you to know about NIST and follow it. Then there's to me, information security management and NIST go together. So the 27001 and NIST, you should do both. And then we'll talk a little bit about how that works together with the 80,001 for risk management of IT networks that contain medical devices. And some of those are private. They're partitioned into just an IT network just for medical devices, which is not a bad idea, but there's some rules around that. And then the agency security plan for Texas. And then we'll talk about some of the international stuff that really matters. The GDPR, the Network and Information Security Agency for the EU, and then the NIS directive. So that'll be in September. Next. Any questions?
I am not part of the R&D projects or in software development. I don't know anything about cybersecurity other than what you normally hear in the news and social media when people talk about like mass data compromises or like financial sectors and things like that, and where they've got requirements set up for this. So when I see all the list of all these different standards and requirements and compliance guidance documents, things like that, to me it's like surprising. So did this just all naturally develop and occur in the last like 10, 15 years? Or how long has this been, I guess, a known developing like area for cybersecurity as applicable to medical devices?
It's been, it's kind of been in the thought process since about 95. A little bit before the first 60601 version came out. And then it's, as the vulnerabilities happen, I mean, Roger and I worked on medical devices where you can send a text string across a COM port and tell it to do something that would harm a patient. So back in those days, that was okay. But now, since everything's connected, it can't be. And it kind of went along with, if you think about how the internet's happened and how we got all connected to each other, and we got devices connected to each other and networking and all that, it's kind of happened in that kind of at the same time. There's always been the data protection thought, but it's been at varying degrees of robustness, especially in the IT and the financial markets have been ahead of medical device, honestly, for a long time because they're protecting people's money, right? And I think the DoD's been ahead of everyone as well because they've had encrypted communication for a long time, right, Dave? It's how long? Forever, right? So, because they're kind of the pioneers of connectivity. So, medical device industry is behind the curve, I would say.
Yeah, that's what surprises me.
Yeah.
When you were mentioning about some of these different standards that are like not yet published or still in draft form, it sounds like that we're still trying to develop those concepts and ideas within our quality system realm, within that sandbox.
Yeah, I think that's true, and I think we're still we're like a toddler almost still, so we have a ways to go. And so that I believe that the risks are going to increase, the vulnerabilities are still going to be there, and the threats are going to increase, and we're going to have to keep doing a better job, and we're going to have to get better at doing a better job faster. So since the rate of the velocity of technology we have to catch up to that velocity, and we're kind of trailing at the moment, I would say. If that makes sense. Roger?
So I know you obviously keep up with this. I don't, but I look at this and I know how hard software is to do right in the first place. Is all software groups and all companies going to double for this? And don't get me wrong, it's not necessarily a bad thing. It's a lot of this, as you said, is good design practice in the first place. And now it's going to be really enforced, but it seems like it takes a lot of work to keep up and make sure you've closed all the loops.
I haven't seen this implemented in a holistic way ever. I'll say that.
Okay. So it's been thought about for 10 years,
So,
but we're on the brink of implementation. So,
yeah.
and if
So-
the government and if everyone's serious about this, it seems like there's a big opportunity for experts in the field.
I think
consultants.
so, and I think one way it could go, which I hope it does, is we can have a library of known good components that we validate that get built into bigger systems, and then we know that together it's more than just additive. It's multiplicative, right? If we have a system built of all known good components that we've definitely strengthened and verified and all that, we'll be way ahead. But it's going to be a while before we get to that because there's so many different paths of technology as well. So there's no like standard med device development platform, right? We all try to develop them, but you have to develop that platform and then do all the known good components in that platform and then build your application from there, possibly. So.
And all these,
Yeah.
sorry, and all the standards that are up there now, and maybe you said this at the beginning and I missed it. What's like FDA's expectation? You said, hey, you need to have something in there, but are they really competent enough to nitpick the contents of those sections?
That's a good question.
That you've known about it.
I've never run into a software astute FDA and auditor yet. So I don't know, Don. What do you think?
Yeah, I agree. I think they're behind the curve as well.
Yeah.
They'll definitely need to be improving their game as well.
So where the you said when they were looking for this data into the back design development area? Or
Yeah, both,
FDA audit?
I would say both pre and post market. They're going to be looking at you're taking appropriate actions to where you are in the life cycle.
Not heard of any, like, you've not heard, I mean, they've not heard of a 483 or something given for any of these kind of things.
Only after something bad happens. Really, it's too late.
Orion platform are some of the cybersecurity application too that well, there have been incidents and there have been, news from even small Canada explaining some of the exposure they have. Most of them related to privacy.
Yep.
But, yeah, there have been exposure. There are myths of possible exposure, potential exposure.
But there's a prevention for that. I mean, what I'm saying is, what I'm trying to say this whole thing is, you have resources for prevention of a lot of the bad things that can happen. So definitely make use of them. And if you don't understand them or whatever, get help from somebody who does, and make sure you're really practicing good defensive design. And it's a different thought process than we've had in the past, where we want to get the device working and we want to protect from maybe unintentional misuse, but it's really I've got to really defensively design this because it's going to get attacked the moment that it gets connected, right? That's not what designers are thinking about. And we have to, because that's the reality, right? So, Dave.
Really not gonna ask you this at any time, but so what's the standard now for third-party modules as far as what's available and used? For example, encryption. It seems like that's the place, if any place in third-party software, you would certified encryption module or whatever?
Yeah, there are.
Is it verified, you know, you can open it up?
There's certified OSs. MICREAM has a certified operating system. That's an embedded operating system. And then there are validated, certified, like encryption modules, libraries you can compile into your system and use as a call, like an API call.
So what's your responsibility with respect to risk management and validation testing?
Well,
When you do, you know, a new release or whatever, can you just bypass all the regression testing of the module if it's?
No, so you have to prove that it works in your environment, that it works properly in your application the way you've used it. But you also get the whole preponderance of evidence from them of here's all the testing they did and verified it and all that, and sometimes you get even the internals of the code and all that, so you can look at everything. But you get their test reports and all that, so you have a little bit of wind at your sails when you use them, but you still have to test them in your application. Maybe not the way you would test it as a standalone thing, does it, you know, do like a white box everything, but you definitely have to test it. Does it do the encryption, and can I try to break in and it doesn't allow me and all that if I don't have the right key and all that stuff. So there are vendors that have modules.
Driver level?
Yeah, they have them at the driver level too. Depends on the environment. There's probably more in the Linux world in that regard. But yes, ma'am.
Is a lot of this regulation proactive, or have there been big events
Um,
in the medical industry?
So the regulation typically lags what it needs to be. I said that right. So there have been incidents where, you know, information's been exposed, devices have been hacked and taken control of, all that. So in general, the regulation's behind. But the good thing about some of these are it gives you, since it is a more of a industry government cooperation, I would say, it's a little bit, you get a little bit more idea what the tools you have to actually achieve what you need to achieve, which is a safe and effective device that works the way it should at all times, right? That's the goal anyway. And that includes in cybersecurity, but it includes everything else about the device too.
So that participation in the ISAO thing, the information sharing, that was one of those, from what I remember, they were kind of framing it as voluntary, but, you know, if you don't, you could be subject to more scrutiny. So there are benefits to actually joining that and participating.
Yeah, they recommend that you participate. So we know what that means, right? But it's not like so it's different than the EU. The EU has mandated it. So there's going to be a whole lot of really open data in the EU when Unimed comes online and all that. So, but that's a different subject.